4 ways to overcome general anxiety disorder. Anxiety disorder is a general term for different kinds of mental concerns that are characterized by excessive worrying about certain things or situations that are either real or imagined. This problem can negatively affect not only the mental state of an individual, but it can also have a major impact on the person's physical health. People with anxiety problems can suffer for many years. It can even progress to a much worse disorder and/or illnesses, and it is for this reason why this must be addressed with proper treatment. What is generalized anxiety disorder? According to MedicineNet.com, generalized anxiety disorder, GAD, is a mood disorder that is characterized by multiple and/or non-specific worries. The fear associated with GAD interferes with the person's ability to sleep, think, or function in some other way. This disorder is quite common. In fact, it is the most common anxiety disorder seen by most primary care doctors. About 5% of people will develop GAD over the course of their lifetime. That translates to millions of GAD sufferers. This illness usually begins when individuals are in their early 20s. Panic and generalized anxiety occur in about 0.7% of children in any 1-year period, up to 20% over the course of childhood. Medication. Medication won't cure the disorder, though it can keep it under control while the patient is undergoing psychotherapy. The main medications used for treating anxiety disorders include anti-anxiety drugs, antidepressants, and beta blockers for controlling some of the symptoms. Anti-anxiety drugs. Benzodiazepines can treat anxiety and have only a few side effects, such as drowsiness. Since people can easily get used to them, they may eventually need higher doses to achieve the same effect. Due to its potential to be addictive, benzodiazepines are only prescribed for a short period of time. Lorazepam is used for panic disorder. Clonazepam is useful for social phobia, while alprazolam can help people with panic disorder and GAD. Some patients experience withdrawal symptoms when they abruptly stop taking benzodiazepines. Most doctors gradually taper it off to avoid anxiety from returning once the drug is stopped. A new anti-anxiety drug for GAD, buspirone, has several side effects such as dizziness, but unlike benzodiazepine, it can be taken for at least 14 days to get the anti-anxiety effect. It is important to realize that some of the medications can be worse than the anxiety. Anxiety sufferers may want to look into anxiety rehabs. At the rehab, doctors and therapists can address the issue most likely with little or no medication. Antidepressants. Antidepressants are developed for treating depression, but are also proven effective as an anxiety disorder treatment. While these medications start to change the brain chemistry after the first dosage, their effect needs a string of changes to happen, and so it typically needs about 4 to 6 weeks before the symptoms begin to disappear. It is very crucial to continue taking the drug to achieve the best result. Psychotherapy. Psychotherapy involves working with a trained mental health professional, such as a psychologist, psychiatrist, counselor, or social worker, to determine the cause of anxiety disorder and treat the symptoms. Cognitive behavioral therapy is a very useful method in treating anxiety disorders. This method consists of two parts: the cognitive part and the behavioral part. The cognitive element helps the patient's thought patterns to be altered positively through stressful situations. CBT therapy usually lasts around 12 weeks, and it can be conducted with a group or individually. Group therapy is effective for treating social phobia. Some evidence showed that the therapeutic benefits of CBT last much longer as compared to patients taking medications for anxiety disorders. Medication and psychotherapy can be combined for treating specific anxiety disorders, and this is by far the best treatment approach for most people. If you or someone you know suffers from an anxiety disorder, call Hawaii Island Recovery at 866-515-5032.